The date was the 25th January 2004, a gloomy leaden night in Guimarães. Benfica had just taken a 1-0 lead. The 24-year-old Hungarian international, Miklos Feher, who had only recently come on as a substitute, assisting Fernando Aguiar to seemingly secure a vital, hard-earned 3 points. All of a sudden, Feher leaned forward and keeled over, dramatically collapsing onto the pitch. Thousands in the ground and even more watching on live TV witnessed the event. And in a flash, a future Hungarian star was gone. Miklos Feher's tragic death, confirmed 3 hours after collapsing during the match in 2004, resulted from cardiac arrhythmia induced by hypertrophic cardiomyopathy, a condition affecting the heart muscle. Although often presents with no symptoms, it is known as a leading cause of cardiac arrests in young athletes. Explanation of sudden cardiac arrest. Sudden cardiac arrest is a critical medical emergency that arises from disruptions in the heart's electrical system, leading to a malfunction in its ability to pump blood effectively. This electrical malfunction can result from various factors, such as heart attacks or inherited conditions that affect the heart's normal functioning. During a sudden cardiac arrest, the heart undergoes chaotic and irregular electrical activity, causing it to quiver or shake rather than contract rhythmically. This chaotic activity, known as ventricular fibrillation, prevents the heart from effectively pumping blood to the body and vital organs. As a consequence, the individual experiencing sudden cardiac arrest may suddenly collapse, lose consciousness, and in some cases, even temporarily lose their memory. The lack of blood flow to the brain and other organs during a sudden cardiac arrest can have severe consequences, including brain damage and ultimately death if not promptly addressed. Therefore, swift intervention is crucial in increasing the chances of survival and minimizing potential long-term complications. Understanding the distinction between sudden cardiac arrest and heart attack. Let's delve deeper into the distinction between sudden cardiac arrest and a heart attack, recognizing that although both are serious heart-related issues, they differ significantly in their nature and underlying mechanisms. Sudden cardiac arrest is characterized by a rapid and frequently fatal event that typically occurs within a span of about 10 minutes. The primary cause of SCA lies in the disruption of the heart's electrical system. Unlike a heart attack, which involves a blockage in the blood vessels supplying the heart muscle, SCA is more akin to a short circuit in the heart's intricate electrical signaling system. In the case of a heart attack, the fundamental issue arises from a blockage or obstruction in one or more coronary arteries. These arteries are responsible for supplying oxygen and nutrients to the heart muscle. When a blockage occurs, it restricts blood flow to a portion of the heart, leading to damage or death of the affected heart muscle cells. The common cause of this blockage is the accumulation of fatty deposits, cholesterol and other substances, collectively known as plaque on the artery walls. A heart attack, therefore, is essentially a circulation problem resulting from the obstruction of blood flow. Conversely, sudden cardiac arrest is more related to the heart's electrical system going awry. This disruption in the electrical signals can lead to a chaotic and irregular heart rhythm, specifically ventricular fibrillation. During ventricular fibrillation, the heart's chambers quiver instead of contracting efficiently, causing a cessation of effective blood pumping. The abrupt halt in blood circulation has severe consequences and can result in the person collapsing and losing consciousness within minutes. It's essential to recognize that while heart attacks and sudden cardiac arrest are distinct, they can be interconnected. A heart attack may potentially lead to SCA, as the damage caused by a heart attack can disrupt the heart's electrical system, triggering a life-threatening arrhythmia. Understanding these differences is crucial for proper recognition and response in emergency situations. Symptoms of sudden cardiac arrest. It's noteworthy that approximately half of the individuals who go through SCA exhibit warning signs in the month leading up to the event. Recognizing these signals is crucial as they may offer an opportunity for early intervention and prevention. General discomfort. Some individuals may experience a vague sense of discomfort or just not feeling quite right. This can manifest as a sense of unease, anxiety, or a feeling that something is wrong without a clear explanation. Chest pain or discomfort. Chest pain is a classic symptom that can precede sudden cardiac arrest. It may be experienced as pressure, squeezing, or a heaviness in the chest. The pain may come and go or be persistent. Extreme fatigue. Feeling unusually tired or fatigued even after adequate rest can be a warning sign. This fatigue may be more pronounced and persistent than typical tiredness. Shortness of breath. A sudden onset of difficulty breathing or shortness of breath, especially if it occurs without a clear cause, can be a symptom to be aware of. Dizziness or lightheadedness. Some individuals may experience dizziness or a feeling of lightheadedness. This can be accompanied by a sense of impending fainting. Irregular heartbeat, arrhythmias, episodes of palpitations or awareness of an irregular heartbeat may occur. Arrhythmias can disrupt the normal rhythm of the heart and potentially lead to sudden cardiac arrest. Syncope, fainting. In some cases, individuals may faint or lose consciousness, which can be a result of the heart's inability to pump blood effectively. It's crucial to note that these warning signs can vary in intensity and may not always be present. Additionally, some people may not experience any noticeable symptoms before sudden cardiac arrest occurs. As a result, it's important to be vigilant and seek medical attention if any unusual or concerning symptoms arise, especially if they are persistent or recurrent. Guidance on responding to sudden cardiac arrest. Let's discuss the guidance for responding to sudden cardiac arrest, emphasizing the crucial steps that can significantly impact the chances of survival and recovery. In the event of a potential sudden cardiac arrest, the first step is to assess the victim's responsiveness. This involves shaking or tapping the victim's shoulders and shouting to elicit a response. If there is no response, it indicates a need for immediate intervention. If the victim is unresponsive, it's essential to promptly seek help by calling emergency services. This ensures that professional medical assistance is on the way while initial interventions are being performed. After confirming unresponsiveness, open the victim's airway by tilting their head backward and lifting the chin. This helps ensure a clear passage for air to enter the lungs during rescue breaths. Chest compressions are a vital component of cardiopulmonary resuscitation, CPR. Begin chest compressions by placing the heel of one hand on the center of the victim's chest, usually between the nipples, and interlocking the fingers. Perform chest compressions at a rate of about 100–120 compressions per minute, allowing the chest to fully recoil between compressions. If trained in CPR, provide rescue breaths after every 30 chest compressions. Ensure proper head tilt and chin lift to maintain an open airway. Deliver 2 rescue breaths, each lasting about 1 second, and watch for chest rise. If available, use an automated external defibrillator, AED, as soon as possible. AEDs are designed to analyze the heart's rhythm and deliver a shock if necessary to restore normal heart function. Follow the device's audio or visual prompts for proper use. Continue the cycle of chest compressions and rescue breaths until emergency medical services arrive. Consistent and uninterrupted CPR is crucial to maintain blood circulation and oxygenation. Remember that timely and coordinated actions, particularly the prompt initiation of CPR and the use of an AED, significantly improve the likelihood of survival in the case of sudden cardiac arrest. Training in basic life support techniques, including CPR and AED use, is valuable for individuals in various settings to be prepared to respond effectively to such emergencies. In summary, recognizing the difference between sudden cardiac arrest and heart attacks is crucial, with symptoms like chest pain and extreme fatigue serving as warning signs. Quick responses such as starting CPR and using an automated external defibrillator AED significantly improve the chances of recovery. The importance of early intervention is highlighted by the fact that about half of the people experiencing sudden cardiac arrest show signs beforehand. Being aware of these signs and knowing how to respond can make a life-saving difference in critical situations.